knowledge in healthcare leadership, policy, and system management. He also holds AHA certification in ECG interpretation and pharmacology. He is AMA-CME certified, AEM certified, and trained in medical coding and transcription, demonstrating his versatile expertise across clinical and administrative domains. He began his professional career as an assistant professor at KB Raval College of Pharmacy, Gujarat, where he guided pharmacy students in clinical practice, patient care, and applied research. His early academic contributions laid the foundation for his growth as an healthcare educator and mentor. Following his tenure in academia, Dr. Jitwa expanded his professional journey internationally. He is the founder and director of Radiant Health Training Center in Canada, delivering certified training programs in ECG and pharmacology, and also serves as a pharmacy assistant at IDA Drug Marts in Ontario, providing patient education and pharmaceutical services. With a solid academic foundation, international training, and a proven commitment to healthcare improvement, Dr. Sahil Jadwa continues to make meaningful contributions to pharmacy education, patient care, and workforce development. The virtual floor is now yours, sir.
Thank you so much for a brief introduction. So we'll start the session today without wasting any more time. Thank you so much once again for the introduction. And today's our session is about ECG. That is about PEBC. Just a moment. PEBC part 2, right? What is PEBC part 2? Like last year, I just explained about the PEBC evaluating examination, but right now I am just about to explain about the PEBC evaluating. Hello.
I request the participants to mute themselves.
Sorry for that. So I'll share the slides. Just if it's visible, just give me a thumbs up or just speak up that the slides are visible.
No, sir.
Just a moment, just a moment. Is it visible?
Yes, yes, it is.
Screen is, yes, sir.
No worries. So the slides are short and simple. It's just about, I have explained clearly about how the evaluating exam and documentation evaluation process occurs. But then also I'll give the brief introduction. First of all, when a student is trying to become a pharmacist, right, registered pharmacist in Canada, he or she needs to follow a particular protocol, and that is the documentation evaluation. First of all, students need to create the NAPRA ID, which is here in Canada, right? So after registering in NAPRA ID, student needs to go through the documentation evaluation process. There are particular charges for NAPRA ID as well, and particular charges for documentation evaluation process as well. So in documentation evaluation process, it is similar that you need to surrender your Indian license and give the good standing certificate to Canadian government, PEBC department, right? And after that, there is a particular documentation process which Canadian Pharmacy College requires from the Indian colleges which the students has pursued the pharmacy from, right? So what all the procedures are like, they require degree certificates, right? The mark sheets and all that stuff, as in the form of the students' information, right? That the students of particular students is belonging to a particular college in India or not, right? This is just a documentation process, and this also requires particular charges. So I'm not going that much in detail in evaluating stuff, but this is just a brief introduction, right? After completing the documentation evaluation process, you have to give the evaluating exam first. That is evaluating exam. It is of like priorly it used to be about 200 MCQ, but right now it's about 150 MCQs. It's like something about 75 questions coming up in two sections, right? After that, when you pass the examination, there are particular 3 trials for this examination. And the fourth trial is the mercy attempt, right? If you fail the 3 trials, you are eligible to get one more trial. But if you fail that, that means you have to follow a particular uh, bridging course or something, like you have to change the province in Canada if you are in Canada. If you are in India, that means you have to like some follow some bridging course, that is regarding the therapeutic course or something like that. Whichever the PBC department suggests you, you have to particularly follow that course, right? So now coming towards the part 2 examination. If a student has cleared part 1 examination, right, that is the evaluating exam is cleared, then he or she needs to go towards the qualifying examination. Part 2 examination is also known as qualifying examination, and it is generally divided into 2 parts: PEBC part 2, MCQ that is, and the last one is OSCE. Some students are like giving 2 examinations together, but some are taking time as well. You can take it, it's upon the student's pace. Whatever the student is deciding that if he or she is prepared with the preparations, so like it depends upon that stuff, right? So this is the general style, right? Just a moment. So MCQ exam is qualifying examination part 1, right? So in this stuff, right, the MCQ examination, there are total something 200 questions, right? 200 questions MCQs are there. It is 4 hours examination. It is totally computer based, multiple choice questions, right? There are total multiple choice questions here. Just a moment. So which area it focuses on, right? Particularly pharmaceutical science. In pharmaceutical science, what are the particular areas? Pharmacology comes up, pharmaceutics comes up, medicinal chemistry. But right now, the role of medicinal chemistry is less in PEBC, but pharmacology and pharmaceutics is the must. And pharmacy practice is the must, because whatever the stuff is there in India, we are not focused that much in pharmacy practice. But here in Canada, it's totally different. Pharmacy practice is the must criteria, right? For example, patient care, clinical decision making, therapeutics, all stuff comes in pharmacy practice. And the last stuff is ethics and jurisprudence. Jurisprudence and ethics is most important here as well. So all these 3 scenarios are coming in terms of test, right? And if a candidate needs to become a pharmacist here, he or she needs to be a particular well versed, that he or she is selecting the particular criteria according to the choice of their MCQ based questions, right? So it's like sometimes we are not trained that much. If we are an Indian pharmacist, right, we are not trained that much, that we are not closer to that much. Here in Canada, this examination, believe me, that it's just like if you are giving a USMLE exam, right, for MBBS, right? There is an USMLE exam. It's just like this. This evaluating exam is also like that, and MCQ is little much easier than evaluating. But sometimes students could not predict the general examination as well, right? So it's just depend upon the logical thinking of the student. What is a particular criteria for a particular drug or a particular question asked, right? So students just need to be logical sometime and don't think too much. It's like whatever you are studying or whatever you are practicing, it comes to that way only, right? So these exams are just building your strength to like future, if you are getting in future, if you are becoming a pharmacist, right? So these scenarios will come in your pharmacy as well. So how to deal with the scenarios in the pharmacy? It's totally different from India and Canada, right? India, it's not like that total. If a student in Canada is pursuing pharmacy from Canada, then also he or she needs to go through PBC, right? After clearing the PBC, then only that particular candidate is available, eligible to become a pharmacist, right? So question style, single best answer type. It's like no negative marking is there. 200 MCQs will be there. Sometimes 2 questions are built up in one question only. Just for example, if one question is there, but it is divided into subsections as well, but it is totally MCQ type, right? There are case-based scenarios, lot of case-based scenarios, right? I know that sometimes it's like you just have to spend 1 or 2 minutes for a particular question, right? And sometimes the question is that much long that you just have to just particularly focus on the gunshot points of the scenario. And after preparing that questions is like sometimes 1.5 page long question, right? And just according to that you have to just select the answers. So 1.5 page question you need to have some focus on, right? So during that time you have to just focus on your critical thinking. How are you just selecting the question and answers, right? How are you thinking? Your logical thinking plays an important role here. Okay, so scoring percentage, right? So 60% to 70% is the passing ratio. 60 is the main stuff, and the result is generally declared by pass or fail. No numerical score is set, right? So yeah, it comes according to the fee structure. What is the fee structure here, right? So first of all, if you are going through documentation evaluation and after that you are giving that an evaluating exam, that is first exam of PEBC, that is about $970. It's about, if you convert into Indian rupees, that is 53,000 something, 53 exactly, about 50,000 something like that. And part two, that is MCQ exam, qualifying exam, and that is about 1,500 Canadian dollars. That in rupees, if you convert in rupees, it's exactly about 93 or 94,000, depending upon the exchange rate of the like rupees and Canadian dollars, right? So some students are, I have probably told you that some students are giving both the examinations together, right? The MCQ one and the OSCE one. It's like $3,000. It's the same price, right? 93 dollars, 1,000 rupees. So late fees applies if you miss the deadlines. So if you are planning for this examination, you just have to particular be punctual and give the examination and pay the particular amount. This is the only stuff which PEBC mainly requires. And for the conclusion, it's professional judgment examination, right? You just have to focus on your studies and whatever the things you are preparing, you just have to be sure about it. And don't, like, people are giving examination, there are three trials, right? If I'm talking about MCQ as well, you can like if you are completing the evaluating exam from India and you are passing it, okay, that's good. Some students are thinking that after passing evaluating examination we have to come to India, but it's not like that. Sorry, you have to come to Canada. It's not like that. You can give MCQ exam as well from India. After giving MCQ exam, right, this qualifying exam, for the OSCE purpose you have to come to Canada. That is the main stuff. And in that stuff you don't require IELTS examination, right? If you are coming to Canada for PBC evaluating and PBC MCQ exam, you don't require IELTS examination. Yeah, but for the OSCE purpose, if you are coming to Canada, you require IELTS examination. Right? There are different scenarios, different stuff here created. Like students are much more feeling complex about how to give the examination and all. What is the particular time? How much time to be spent about? It's like if you are completing a farm D or B farm, right? Anything. So whatever the time you give in your degree, you have to just give in PEBC. It's like some people are freshly prepared, right? Freshly graduated students. So it takes about 6 to 7 months to um, be prepared about this examination, right? So this is the main stuff. Uh, Question, if anyone is having regarding the how the question paper pattern is, I can also uh, brief you about that. So this was just a part two examination, how it works in uh, MCQ examination in Canada. If anyone is having any doubt, just can ask about it. Hello.
Yes, sir, we have few questions.
Yep.
What is the validity period of a Canadian permanent resident card?
Permanent resident card? Hello.
Yes, sir.
Permanent resident card is like you are talking about PR or like the Canadian license examination, right?
Yes, sir, license examination.
Okay, license examination, right? So if you are clearing the part one examination, right, that is your evaluating exam, right? In that stuff, you just have to be prepared about if you are given a particular time. If you are making a documentation evaluation, there is a 3 years period. In this 3 years period, you have to just go through that you are completing your whole pharmacy exam in 3 years. But after that, if you are not able to complete in 3 years, that means you have to go through the documentation evaluation process further. Like once again, there are particular charges as well. But if students, I haven't seen any cases like that. If they are not eligible to make it once again, because this much money, right? If students are not making up to pass, that means it's like three exams, three trials. Some students are like not able to get pass, right? So they are not eligible after that. Most probably, and the last one is the mercy trial. So I can say that for a particular examination, if you are giving evaluating examination, so that is about something period of one year to 2 years, right? After that, you have to give the MCQ examination, because if you are not giving that examination, that means that evaluating exam will also not be considered after that. So once again, you have to reappear for the evaluating exam.
Thank you, sir. The next question
After
is what is the minimum IELTS academic overall score usually required by PEBC?
it's not like that. No like particular criteria. Like if you are becoming a pharmacist, right? So in that purpose also, like they don't require any particular score. If you are applying for permanent residency or like that, they require a particular score sometimes. But as a healthcare professional, there is a minimum require of 6.5 to 7 bands. That is like generally every students can score, right? So in Canada, if you want to enter, that means 6.5 bands are mandatory and 6 bands in each module. So that is the criteria. Okay. Kiran Kamlesh, starting package in Canada. So it's not about the package, right? Here it is the hourly pay of a pharmacist. If you are talking about a package, just consider that if you are becoming a pharmacist, and after 1 to 2 years of pharmacist, like if you're becoming a registered pharmacist here in Canada, per hour pay will be around 80 to $90 sometimes, if you're working in a reputed drug mart for a basic pharmacist, right? If you are becoming a clinical pharmacist here in Canada, that means it is more higher pay, because that requires too much stuff, right? So $100 per hour. So that you can consider that according to your pace, you can work. Because I have seen pharmacists coming here as a relief pharmacist, right? They don't work in weekdays; they work in weekends. So you guys can consider that only weekends sometimes they can pay, right? They work like 3 to 4 days, say they work, and rest of all 3 days they took their day off. So according to their pace, they can work. This is like a shift post here in Canada. Here, all the pharmacists are following that. Some pharmacists are not okay to work in a particular corporate field, so they just work with their own pace. Some pharmacists are like particularly following 7 hours of shift from Monday to Friday, right? So it's like depending upon the pharmacy which you are working. Some as a starting pharmacist, if you are becoming a pharmacist, you are not having that much experience, right? So in that stuff, your pay will be around 40 to $50 per hour per hour. So if you're working for 7 hours or 8 hours, if it's maximum in the pharmacy here, so you can just consider it as a monthly. It will be going around a 7 to 8 thousand dollars, something like that. So it will be like 6 lakhs rupees something. Sorry, 5 lakhs rupees. Okay, any questions more about the PEBC staff pattern? Just a moment.
Sir, is there any minimum work experience in home country needed to apply for PEBC exam?
No, it's not like that. If you are graduating from Canada, right? From India and coming to Canada, PEBC doesn't judge any type of stuff. Yeah, but I suggest you that if you are coming to Canada, right, after becoming a pharmacist there in India, you just seek for pharmacy assistant job, because that is the job which helps candidate that how the pharmacy, the environment of pharmacy and how the pharmacy works here, right? It will be showing all the stuff. So, and it will be easier for you to pass the PBC examination as well. Okay, Manasa just answer questions that after qualifying the exam, is there any internship period in Canada? Okay, so in this stuff, like it's like after qualifying examination, that is MCQ, right? You have to give OSCE exam here in Canada. So after OSCE, so something like you have to go for a particular jurisprudence exam, right? So if you are clearing that exam, that means you have to particularly work as a pharmacist will be around 6 to 7 months in a training period, right? So after that, you are eligible to get your particular license here. So all the stuff and process will be worked here like that, right? Any question more about the type? Okay. In PVC examination also required for industrial pharmacists or those involved in research.
Hello.
Every
For
pharmacist, if you
myself,
want
Ashok Kumar.
a license here, you will be requiring to appear PVC examination. Yeah, who was about to ask a question?
Hello.
Yeah,
Sir, am I audible?
yeah, you were audible. Ashok Kumar, right?
Sir. Yes, sir, myself. Sir, I have a doubt, sir.
Uh,
Sir,
yeah, go
after
ahead.
qualifying part 1 exam, shall we prepare to part 2 or simultaneously we can write both of?
See, you are talking about the evaluating exam, right?
Yes, sir.
So after the evaluating examination, you just have to prepare for this MCQ exam, right? That is a part two examination. But it is not like that. That first you have to clear the evaluating examination. Evaluating examination is the basic. You here evaluating
Okay.
examination is the toughest exam, right? I can say that
Okay.
because it covers finance as well. In India, the pharmacy students are not like studying finance here, right? But here in Canada,
Okay.
evaluating examination requires finance. There is a topic of finance, pharmaceutics calculation. I can particularly say that in PharmD, if you are a PharmD person, calculation is not your stuff, right? But
Yes.
you have to go through it because in pharmaceutics we don't that much elaborate and pay our attention. Most of the PharmD students I can find this difficulty that they are not good in calculations because we are not like calculating like that, right? Only 1 year of pharmaceutics is there. So in that stuff, we are not totally focused into calculation. So first of all, You have to clear your evaluating exam, then only you are eligible to take MCQ, that is the qualifying examination. And some people are giving that is part 2 and OSCE exam together. An OSCE exam is just like an interview session, like you are a pharmacist in the pharmacy, right? And the invigilator or the inspector will come in front of you as a patient, and he will be asking you about the stuff that he or she has been taking this medication. Just for example, I'll just create a scenario that
Okay.
patient comes in your pharmacy. If you are a pharmacist, right? You are in which year,
Okay.
Ashok, right now? PharmD?
So I'm currently 5th year, sir.
Fifth year, right? So you are
Yes, sir.
knowing about the medications, right? How the medication works. So if you are a pharmacist in your pharmacy, right? And just for example, a patient comes in your pharmacy, right? Asking that the
Okay.
patient is having a prescription of drug that is naproxen and esomeprazole combination. Here in Canada, we say that it is a drug like brand of Vimovo, right? Naproxen 500 and
Okay.
esomeprazole 20 mg. This combination of drug comes in your pharmacy as a prescription, and you are just processing the prescription, right? But when you go through the patient's file, patient profile, that means the patient is taking pantoprazole 40. So is it okay to give all these medications together? See,
We should
naproxen,
prescribe individual.
esomeprazole, yeah,
I mean, dispensing should be individually, sir.
sorry.
We should dispense individually, no, sir.
Individually, no, but how will you explain the patient? Patient is saying that I want my regular medications as well, and in that regular medication, patient is taking pantoprazole as well. So patient says that I want that medication as well. So how will you tolerate this stuff?
Sir,
What
in
do you
that
say?
scenario, uh, what patient has asked, it should be, first of all, it should be reviewed. After that, we should dispense, sir.
So the thing is that pharmacists can take a direct authority here without going through a doctor, right? Because doctor has prescribed a particular combination, that is naproxen esomeprazole combination. Esomeprazole is also PPI, right? And pantoprazole is also PPI. So you have to see that till how many days doctor has prescribed naproxen and
Dispense, sir.
esomeprazole,
If we have
right?
any, if we have that medication, we can directly dispense, sir.
It's not like that. It's how many days it's prescribed. So just for examination, if a patient is prescribed for 7 days, that means that patient needs to stop pantoprazole for 7 days and work for naproxen and esomeprazole till 7 days. After that, that medication we have to give that medication for particularly process that medication for 7 days only, right? And after the 7 days, you can just tell the patient you have to not take this pantoprazole for 7 days, but yeah, you have to take this medication naproxen and esomeprazole combination for 7 days. After the 7 days only, after the 7 days only, you have to start your regular medications. So this is the time period how the pharmacy here works. As a clinical pharmacist or a pharmacist, we play an important role here, right?
Okay,
It's
sir.
not Anand, side effects will block stools if swelling. It's not like that, right? Because here the combination is legal and legit, right? Legal and legit. 500 by 20 mg combination is there. You can search in Google as well about that combination. That combination is available. So for 7 days, particularly for 7 days, if a patient is in pain, severe or chronic pain, right? So naproxen is done. For long term, it's not for long term, it's for 7 days. So just for example, BID is the choice, right? Naproxen, esomeprazole, BID, right? You have to take
Okay,
a
sir.
if medication comes here, right? You have to process for 7 days. That means total medication dispense will be about 14 medications. if a prescription is written
Yes, yes.
BID, you have to take one medication twice daily, right? That is naproxen esomeprazole combination, and 14 medications will be 14 total drug medication will be dispensed. So in 7 days, those medications will be completed. So after that, you can just start the pentagram. It's like that. This is the examination question only. Uh, Ashok,
Right.
you can
Okay,
understand
sir.
that, I
Thanks.
guess. Right? Yeah.
Yes, sir.
Sir, can I?
Yeah, you can ask Anand.
Sir, I want to ask, sir,
Your
what is
your voice is not audible. Just a moment. Okay. Now you can speak.
uh, sir? My question is regarding the curriculum. Sir, is there any difference? And it means what difference? I am asking about training based
Training
in
base in the sense in PEBC and like pharmacy in
no
India.
no. Yes.
Okay. So right now PEBC has changed the scenario. What all the stuff we are learning in pharmacy, the evaluating examination, uh, the questions are from first to sixth year of PharmD, right? What we have learned in for from first year to sixth year, that all the question comes in this stuff. But I can say that finance is not our cup of tea, right? From pharmacy background, as you are coming from India, we will not be having this finance stuff, but you have to study that stuff as well. So I can suggest you that there are classes in India as well and in Canada as well, that prepares for PEBC for the student. So you can just switch that classes to. So curriculum works according to similar only, but there is some stuff that is in pharmacy management comes, right?
No,
We are
sir.
not
Sir,
focused in pharmacy management as a
sir,
PharmD
my
candidate.
question is, as you have given the that particular syllabus for that PEBC MCQ type,
Yeah,
and that case-based scenario for OSCC.
yeah.
Then
OSCE.
we,
Yeah,
yes,
yeah.
yes. Uh, for that we need to some preparation, no, as that is a case-based, and in India we are not that much acquainted with it.
Yeah, so the thing is that you have to just I was enrolled in particular classes in Canada. Two classes are like particularly hot most favorite. They just train student a lot, right? That is pharmacy prep, and one more is pharma chief one. If you start from India as well, there are particular classes in India for PEBC. When I was in India, I started with Enlit Pharma Vision, right? That prepares students for PEBC, and they are like giving this multiple choice questions as well, that how the students can prepare. You are knowing that of how the clinical medication works here, but in MCQ you will be feeling like all the questions and all the options, like whatever the particular questions is asked, all the options are particularly relying in that criteria only. So you can feel that all the options are the right answer, but according to your critical thinking only, you have to select the particular answers. So in that role, this classes plays an important role, right? So yeah, in I can say that as we are a PharmD candidates as well, we are not trained that much for this competitive examination. So for that we need to train and
Yes, sir.
get a particular enrollment in these classes like this. You have to
Yes.
search for that in India. We have I am particularly sure about in India there is Ended Pharmavision, which I did, and the coach is Nitesh Viramgama sir. He is a very good sir. Like he's teaching the basics of pharmacy. From the base, he's teaching the students. So that will clear your base as well, and will guide you towards the future.
Okay. Okay. Thank you, sir.
Yeah. Any more questions? Okay. From which year of PharmD we should start to prepare for the exam so that we are ready to give exam after we graduate? Okay. Um it depends upon your choice, but I can say that fifth year, after fifth year, right? When you are in fifth year, you are like pretty much not with that hectic load, right? Just there are three subjects in PharmD, and you are working for this thesis, right? Thesis one. So that is also chaos stuff, but you can start preparing from fifth year only, because whatever the drugs you are selecting and seeing each other, like you can start from fifth year, because I started from fifth year, and that is pretty much going well right now. It depends upon your choice. Some students are preparing after sixth year, after graduating from PharmD. That is also your choice, right? But I started from fifth year. So fifth year, sixth year, still that we get a clinical booster. Okay. Yep. More questions? More questions, I guess. After completing M.Pharm, I can do PharmD or not? Which year time? Okay, you can, if you are after completing B.Pharm, I guess you can do PharmD, right? But M.Pharm is like you can do PhD after that. Why to do PharmD then? After completing M.Pharm, you can do PhD. You can earn that a doctorate degree as well, right? There is a particular after if you are becoming an master in pharmacy, right? There is a particular stuff you can do PhD in, that is pharmacy practice, right? Pharmacy practice you can do PhD, and you can earn that doctorate degree as well. And one more thing, that if you are completing B Farm and you are selecting M Farm, right, and you think that you can do clinical practice as well, you want to become a clinical pharmacist like that, right? And you don't want to do PharmD. That there also there is a particular specialization in clinical pharmacy. You can do that as well. Residency program is also there after PharmD. You can enroll in that program as well. Yeah. PharmD is not mandatory, Rohit Kumar. After that, you are completing already masters in PharmD, and you are sorry pharmacy, and you are becoming a PharmD, and you are enrolling for PharmD. That doesn't make sense, right? You can just do PhD in pharmacy practice. That is good choice. Okay.
Sir, I guess there are no further questions.
No questions. Okay. Thank you.
Thank, thank you, Dr. Sahil, sir, for your clear and detailed explanation in Demystifying PEBC Part 2. Your guidance has made the path to international opportunities much more understandable and achievable. Thank you for joining with us in SYCCON Day 13, sir.
Thank you.